to tonight's webinar. My name is Rajat John, along with Maggie Chung. I'm the co-chair of the RFS Communications Committee. On behalf of the SIR-RFS, thank you for taking your time out tonight to be here for this informative webinar on starting an IR interest group. Before we hand it over to Dr. Kumar, I want to remind everyone that this webinar is recorded and will be available on YouTube simply by searching IR Education. Anyone can ask questions at any time by entering them into the question panel box, which is on your control panel, fourth from the bottom. And we'll keep track of them and answer them at the end. And also, don't forget to check our website regularly for upcoming events and follow us on social media and Twitter. So without further ado, I'll hand it over to Dr. Kumar.
Okay, thank you, Rajat. Can you see my screen?
So now if you press the show screen button at the top, it should show your screen.
What do you see?
Now we're good.
What about now? Yeah, still good?
Yep. We see the slides.
Okay. Perfect. So will anybody chime in? Let me know if there's any questions. But thank you again for joining. This is our second IR Outreach Program webinar. We had a lot of feedback after the first session on how exactly go about starting an IR interest group, especially a lot of these institutions where you may not have IR faculty. So we wanted to provide a webinar where we could give you information about how best to create a local group at your school. Again, the IR Outreach Program team members, hopefully some of them will be able to make it. I know many of them are busy with clinical rotations. We have Jamal Jefferson, Nabi Diab, Mario Cedillo, Danya Day, who they make up the core team, and many of them may have reached out to you via email inviting you to the program and these webinars. And of course, Joy and Sean helping us from the SIR side of things. From a faculty perspective, there's myself, Vishal Kumar, as well as Dr. PJ Roshan, who is happy to serve as faculty advisory as well as mentorship roles for you in the IROP program. So taking a step from last time, I think the Medical Student Council for SIR has been very successful over the last 5 years in spreading the word for interventional radiology throughout basically the United States and medical schools throughout the country. Rajat can correct me if I'm wrong, as well as Aaron, but I think we are close to surpassing 100 interest groups nationwide. But of course, your institutions, your home institutions, I believe have not yet formally created IR interest groups. And we are hopeful with your help, we can help spread the word and add you to the map as well. So many students have been through this before, interested to know how it is that they can create these IR interest groups. And so with a lot of feedback that we've received over the years, SIR Medical Student Council has put together a very comprehensive manual on how you can go about to set up an interest group. So if you see the link at the bottom, you can have a downloadable PDF that you can refer to that'll give you some nice tidbits on how exactly you can start an interest group. And we'll talk about some of those pointers as we go through the talk. Okay. And what will be answered is how exactly to establish an IR interest group at my school, how might you go about getting funding, how can I advertise to recruit people to the IR interest group, and what sort of opportunities might be offered that you can use for your IR interest group events. So one of the first things you want to consider doing is looking through your medical school faculty listings, specifically within the radiology department, and see if there are any interventional or diagnostic radiologists who may be willing to serve as advisors or mentors for your IR interest group. Do a local search if they're not at your school. Perhaps they might be regional, or there might be an affiliated institution that has IR faculty that are willing to invest some time in mentorship and advisory roles. And again, you can check the SIR website, www.sirweb.org, the Patient Center link, to see if there are any doctors close by your institution. And if neither of those two options work, feel free to reach out to either myself or Dr. Roshan for some guidance. We are happy to serve as your early mentors for the interest groups, and hopefully we can find somebody locally to carry the baton. One other alternative, if you don't have the support or the faculty directly for interventional radiology interest groups, would be to partner or join forces with a diagnostic radiology interest group. Many of you at your home institutions, I am not even sure if you have radiology interest groups. So we'd all appreciate it if over the next coming weeks, if you could find out if your institutions have diagnostic radiology interest groups, and if that might be a good way to sort of get your foot in the door in terms of having a group of students who are interested in imaging and image-guided procedures. Alternatively, as we've done at UCSF, some of the medical student interest groups have organized around modalities and specialties rather than individual fields. So for example, there might be endovascular interest groups or surgical interest groups that cover a broad range of specialties, including vascular surgery, trauma surgery, surgical oncology, etc. So many different options for organization. I think what we, as part of the IR outreach program team, are hopeful of is that with this program and your creation of IR interest groups, that we can increase awareness and exposure of interventional radiology to a larger audience of medical students. There's no mandatory level of activity. I think it's one of those situations where the more you put into the project, the more you'll get out of it. Minimum considerations, I think if you can start to organize an IR interest group email roster at your home institutions, we can help then distribute and disseminate virtual events, which can be coordinated fairly easily, like today's webinar. Consider quarterly meetings where you, with a small group of students, meet locally, with or without food, with or without funding, but hopefully you have either a faculty or a fellow or maybe even a resident sort of mentor or support during the session. And then other local events, this is where we can open up for brainstorming towards the end of the session. If there are sort of meet and greet opportunities, if you consider raising funding through SIR diversity and inclusion microgrant support to have speakers come visit and create maybe single day events, IR related symposium at your schools, could be another opportunity. So again, we talk about types of events. I think nowadays it's easy to separate them into local live events versus the virtual events such as webinars and that type of series. I think the benefit of local events is that you have speakers, you have opportunities for hands-on sessions, there's great opportunities for engagement, students can meet different faculty in the field. Some of the limitations that I think students have occurred in the past is it can be difficult to organize a lot of people, especially at this stage in your careers. Funding can be difficult to find money for support, either if it's to get product for simulation sessions, needles, catheters, guide wires. It can be difficult to get funding for food or even rental fees for location and cleanup. And then advertising can be a little difficult depending on what your avenues are. And then again, finding faculty can be difficult for some of these events. The other alternative is to organize your local interest groups around virtual events. And those can include didactic lectures, webinar series that are currently going on, as well as other speaker events. But those are a little bit less ideal because I think the true impact of interventional radiology is lost when you're just looking at PowerPoint slides. So you don't really have the opportunity to see what it's like for patient interaction, either in the hospital setting or in the angiographic suite. But hopefully it's a good way to get people's interest high, and then they go out and find mentors and clinical shadowing experiences. So what are the types of educational opportunities that should be offered? Some of the opportunities that we see locally are noon lectures or resident lectures. If you can partner with maybe a local diagnostic resident or fellow to help provide some lecture series. Alternatively, there are local and national webinar series that have started over the last couple of years that could be a good way of organizing along a calendar. So for example, the UCSF Introduction to IR webinar series is starting next Thursday. We're having students sign up individually for the weeks as they come, but the week 1 sign up is displayed here. I'll be giving that session. It'll be a pretty broad introduction to interventional radiology and hopefully an overview of the course, the 11-week webinar series. If you're interested in actually attending the entire course and getting a certificate of completion, consider registering through the second link where you'll take a pre-course survey. This will make you eligible to receive a certificate of completion from the UCSF IR department. Earlier, hopefully about a month ago, some of you may have received emails telling you about the Introduction to Research program, and that webinar series is starting this Sunday. I think registration for that has closed, so hopefully those of you who are interested were able to sign up. And then the other opportunities would include shadowing programs. Again, that can be difficult if you don't have faculty locally. IR symposiums that may be occurring regionally that you can have access to. And then research opportunities that you may find either locally or sponsored through the SIR. And I think recently I've seen some social media posts about SIR student scholarships and internships that are available. And I think that deadline is approaching, maybe January 13th, but we can double check that. So how can you fund your IRIG? If money is something that you find to be a limiting factor, consider talking to your student affairs office. Consider going to the radiology department or your local student government association, or if there are other groups that have sponsorship already, it may be nice to partner with them. So some examples of noon sessions or events that could be hosted include partnering with vascular surgery to talk about different kinds of endovascular therapies that are available to patients, trauma surgery to talk about the role of IR in trauma, OB-GYN, a lot of interventions for female patient populations, so it could be a good opportunity for partnership there, oncology, gastroenterology, urology, so multidisciplinary approach to education, and might be a really good opportunity to partner with other specialties. Find out where the food is already going. So if there are events where free food is already provided, if you can partner with those groups, it might be a nice opportunity and help you save the hassle of having to find individual costs. And then lastly, some institutions are okay with outside vendor support. UC and UCSF are not okay with that, so we have to find in-house support, whether it's through the Department of Radiology or the Interventional Radiology section. But other universities may have no issues with vendor support for food and product support. So it may be worth talking to your student affairs office to see if that's an opportunity, because I know many of the device companies are interested in education and outreach. How do you advertise for the IR interest group? Again, if you could help us out and get a roster or an email list of all your classmates or students in your school who you think might be interested in this sort of outreach and education, and start sending those emails to advertise the groups and advertise the events. Announce the meetings usually a week before, the day of, during class, before school lectures. Consider using your school or class's social media pages to advertise for the IR interest group. If you haven't already, consider creating your own social media page to link the accounts and also help participate in career fairs, setting up booths to promote the interest group. Now, speaking of social media, a lot of the different academic institutions have taken up social media accounts to help spread the word. SIR's Resident Fellow section has also been a pioneer in really getting a lot of social media attention, so I definitely recommend you following them on Twitter. UCSF has both Facebook and Twitter accounts. The first one you see is our Twitter handle. The second is the Facebook account. We try to post news and updates about the application process, upcoming webinar series and events, and other news related to interventional radiology. And I think a lot of the other Twitter accounts have great educational content to show you really nice cases, really nice imaging, and how it relates to patient care and minimally invasive procedures. Also with social media, YouTube has an incredible amount of information and educational content. If you subscribe to the channel, you'll have access to a lot of these webinars as well as prior recordings. And for those of you who are interested in the application process, for example, there's the residency program director webinar, introduction to IR tools if you were starting a rotation and wanted to know what the instruments were that were used. And then of course, the interventional oncology session is fantastic. And again, the UCSF IR webinars are coming up very soon, starting next week. Hopefully some of you will chime into that as well. So speaking of social media, if any of you who are on social media may be aware of the Interventional Initiative, this is a sort of nonprofit group that was started to help spread the word about what interventional radiology is. As you can see, they take a very patient-centered approach, belief that the more patients are educated about their options for minimally invasive procedures, the better overall care they can receive. So they're really about the partnership between the physician and the patient. As you can see from a screenshot, the mission is to increase awareness about the life-changing value of minimally invasive image-guided procedures. And they have some really nice episodes. They've talked about different cases with cancer and venous disease with blood clots and shown them from the patient's perspective. So it might be worth checking out. And they also have a lot of interesting information if you're interested in learning more before the webinar series starts. And the reason I bring it up is because on their social media pages, they're having a Without a Scalpel Day on January 16th, 2018. And they're really interested in what creativity is out there to promote interventional radiology and the minimally invasive procedures that exist. And so I think on this day, if I'm not mistaken, they're basically looking for people to submit their best ideas and their best graphics. And why this is important is because grand prize is $400, and I think anything's worth trying for $400. Second place, you get a graphic featured on a t-shirt and $100. Third place, the story will be featured in a Huffington Post article or a $50 Amazon gift card. And then there's also another best social media influencer. So I think if you get the most likes, you might be in for a treat. So if you're interested, check out the initiative. It might be a good way to spread the word and also express yourself if you are creatively bound. And then we'll touch quickly about the symposium. I know the 2017 to 18 symposium season is coming to an end, but there are still some symposium left. We have the University of Wisconsin symposium coming up in January 13th, Cleveland in March, and I think the Midwest, which typically starts the next year's cycle, will be coming up in April. So keep an eye out for the symposium list if you're interested in attending something regionally. And the map should be on the SIR website, the RFS website. So feel free to check that out if you want more information. So with that, I think I'd like to open it up to the participants, either Aaron, Rajat, if Rebecca is here, to share their experience of how they may have created IR interest groups locally at their schools, and then open it up for questions from the ambassadors who phoned in and joined the webinar.
Hi, this is Aaron. So you want me to just give a brief rundown of how I started at Cleveland Clinic?
Sure.
Questions, or do you want? Okay. So it's kind of interesting, even though we have a really large IR department at Cleveland Clinic, like it's just about to reach 19 people, 19 attendings. There's only been 2 people from my school that have ever gone into IR. It's a small class of like 32 students per class, and people just don't hear about it. So it's kind of starting from scratch. Made contact with one of the attendings and started bouncing some ideas off of him, but really had to drive it forward. We started with just a lunch seminar. the department had a little bit of funding, and we just got a lot of different kinds of pizzas during lunchtime. Almost anyone would go for free food. And in the emails, one thing that we did that was kind of effective to get people's interest is we just posed a couple of rhetorical questions, just in bullet points. Like, are you considering surgery? Are you considering, or do you like problem solving? Do you like working with a lot of different doctors? Do you like working with technology? So people would just see those and they continue reading instead of just thinking, oh, it's radiology, or I don't know what this is, or I know I'm going into surgery, and tune out. So that worked out very well. From that point, I was able to get a few other people that were interested. And at this point, then I have the goal of getting one person from each class to be involved in the leadership of it. So there's good continuity throughout the years, and that's a good way of retaining it. But there's a lot of really good resources out there on the RFS website. So if you ever have any questions and you think, you know, I want to do a seminar, but I don't know where to find something, or I don't know if I can plan a presentation, because usually attendings are really, really busy. And if you can tell them, hey, I have a slide deck you can base your talk on, it's a lot easier. But hands-on demonstrations, like looking at catheters, we did an IV or a jugular access sim lab thing, and that was really popular too. So it just starts with one person. Usually you can find some way of getting free food, even if it's a potluck with a couple of your friends at school. And then from there, just try to appeal to a lot of people. You don't have to recruit everyone. If you get a couple strong people, then it just builds from there.
Hey everyone, this is Rajat here. So I'll share my experience. I finished medical school, and then I went to Toronto to do some research with the radiology department at Toronto General and Sick Kids. And I guess this was around the time where I had been to a couple of SIRs, and I had started gaining some knowledge about what the IRGs are about and why they're so impactful and serve as a utility for trainees, especially medical students. So I was there in the hospital, and there was another University of Toronto medical student who was interested in radiology. And I had assumed at that point that, you know, somebody at Toronto had probably already started something like this, or if they didn't, I had mentioned it to this medical student. I said, you know, hey, do you guys have an IRIG? And, you know, they didn't know what that was at all. And I thought maybe somebody else within their medical school had either known about what an IRG was or was starting it. And it's just funny how your assumptions don't really pan out. It's just, there was a lot of interest within the school for interventional radiology, but nobody had at that point known what an IRIG is or tried to start one. So we basically teamed up, and we got in touch with the appropriate individuals within the medical school who helped start interest groups. And there's a very formal process that takes place, and I think that these types of formal processes probably occur at, you know, a little bit different institution to institution, but there are formal processes that need to take place to actually establish an official interest group. So their process was to have an official meeting in their auditorium. They would help get the word out through the listserv and spread it to the entire student body. And it was basically just a half-hour session of me and one of the interventional radiology fellows talking to a group of interested medical students who the turnout was just, was beyond our expectations. We thought maybe a handful of people would show up, but the room was really full. There were at least 50 people in the room, I would say, all who had either specific interest in interventional radiology or radiology itself, or just kind of wanted to know more. And we gave very brief presentations on why we had interests, what the field is all about, and then the audience had a lot of questions for us. They wanted to know more about the field. They wanted to know more about the training process. They wanted to know how to get into the field, these types of things. And it eventually turned into, because the faculty got ear of it, and they were really kind of surprised by how much interest there is. And the IR faculty at the Children's Hospital and the adult hospital kind of got together and reached out to industry, and then industry ended up putting together a formal event for all the interested medical students to come and meet all the faculty and to have more questions answered about the training process and getting into the field and those types of things. And actually vendors were there as well, and they had their products set out so people could play with simulation type things and catheters and wires and all that. And from that point, it grew, and there's been a lot of positive response. So yeah, that's how we started.
Is there anybody else on the line who could share their personal experience? Raja, do you see any questions coming in from any of the ambassadors?
So we don't have any questions so far.
Well, I'm happy to open up to any questions. If anybody has anything specific or anything we didn't touch on in today's session.
So if any of the attendees have questions, you can go ahead and type them into the question panel in your control panel, and we'll be able to see them and field them for you. Okay, we have one from John Flores. He's asking, how many minimum students for an IRIG?
That's a really great question. Basically, I think for every ambassador, we'd like one other student. So if you can find one other person who's interested in imaging or IR, I would consider that an interest group for the purposes of IR outreach. More would be always better, but one is great. Any other questions? Well, I know it's late on the East Coast, so I want to thank everybody for coming. Roger, if you see any other questions, feel free to let me know. Otherwise,
I have one question.
Okay, go ahead.
From Abner is asking, how should we coordinate virtual events?
I would probably recommend, so you will be, as ambassadors, you should receive direct emails on registration links and links to webinars. From there, I would recommend forwarding those links to your email listserv. And hopefully that way, it's easy to coordinate. The other option is to have everybody gather around one laptop, and then you sort of make it a virtual local event. But that can be hard if everybody's at different sites or on different schedules.
So just one thing to add, this is Aaron speaking. So make use of that table and the webpage that shows different IRIGs across the country, because they should have updated contact information for all of them as well. So if you don't know of anyone near you, then just reach out to one of those groups at least. And then as you find more information, encourage them to send their updated IRIG information to the email list on the website, but that's a good starting point as well.
Any other questions?
No, we just have some thank yous and some appreciation for the webinar. So thanks a lot, Dr. Kumar, for putting this together.
Okay, welcome. We really appreciate your time and your effort to help spread the word, and hopefully we'll see a lot of you either this Sunday for the Introduction to Research webinar or both starting next Thursday with the UCSF webinar. But thank you, everybody, and if that's all, have a great night, and I'll end the broadcast from here.